I'm Dr. Funke Afolabi Brown, the founder of Restful Sleep MD. I'm excited to be here, and I have such a treat today for you all. I have the honor of having Miss Jacqui Onoz here to just talk to us, and we're going to be having a really fun conversation about fatigue, functional medicine, and all those things that make you feel drained and exhausted no matter what happens. So good to have you, Jacqui. I hope you're doing well, and just tell us a little bit about yourself.
I'm doing fabulous. Thank you for having me on. A little bit about me. I am a pharmacist. I have been a practicing pharmacist for over 25 years, and somehow got led into functional medicine really early on in my career. And somehow I've come full circle, and now I've come back to functional medicine later and focusing on that going forward. I think I've shared with you my own struggles when I first got licensed and started working. And I was in a very older location. And for some reason, even though I had worked in pharmacy since I was 16, I started getting a lot of itchiness and hives, and it was only when I was at work. It was never when I was at home. So just really weird things. I thought, well, is it like ink or paper or something like that that was causing these reactions? But little by little, it started to get worse and worse. And I spent 7 years going to multiple doctors, trying to figure out what was going on. I got to the point where you couldn't even hug me because I would break out immediately. I was so embarrassed whenever I'd had to, do a counseling for one of our patients, and, they would talk to me and I would break out in welts right across my face. And it was just the craziest thing. And the only thing I ever got was, we may never know. It's idiopathic urticaria. We may not know what it is. Here's a couple of prescriptions. Here's a steroid pack, several antihistamines. That's all we can do. The final doctor, that was my end, basically told me I must be depressed. Here's a prescription for an antidepressant, and sent me away. So, I was helping a customer looking for supplements, and she was telling me about this one doctor who's a functional practitioner. Went right to see her. I figured I didn't try this. And I am not kidding, within 3 months, to this day, it's been 21 years, and I do not have one hive. And for me, that was just like, what was missing in these 7 years of seeing these doctors? And really, it was just why. No one asked why. They did the labs. They tried to do their tests. They couldn't get an answer. They'd send you off with a prescription. And there was no investigation, right? No deep diving into any of this. And I just felt like, gosh, this is what we're missing. We need to move more forward into this. And, went back into still in pharmacy. Once you know what you know, and it became just increasingly difficult over time because this is what we've become, right? The person comes in, oh, I've got cholesterol, here's a prescription. I have diabetes, here's a prescription. I'm really tired. Oh, you must be depressed, here's a prescription. Like, it's just an easy fix, but we're not exploring further to prevent someone from taking the medication, or even try to maybe even slowly remove them, right? And deprescribe them from the medication. There's always a push to take the drugs, always a drug push. And I just got to the point where it just wasn't fulfilling. It was just eating away at me. I felt like I wasn't doing what I was supposed to be doing. I'm here to help people, right? And I'm just right now, I felt like a drug dealer. Like, I'm just pissed. I'm just, counting pills, dispensing them, and that's it. So I went into functional medicine, and I started exploring that and realized that pharmacists were becoming functional medicine practitioners. And as soon as I found out, I was like, sign me up right now. Where do I jump? And how do I get in here? How can I impact people's lives the way that doctor impacted mine? Because it just completely changed the trajectory of everything in my life. It's almost like full circle, right? I somehow started there, and now I'm ending there. And now I got the luxury of being able to help others, and see them improve their health and regain their energy and suddenly start living a life that they've always wanted to live, but were too scared they wouldn't be able to, or were told that they, this was it. There was no other options. This is where you're going. So I'm very excited that my life has taken this trajectory, and I guess I needed to go through that experience to get me where I am now. And I'm so grateful for that.
Yeah, no, that's incredible. And I'm just so glad that, you've now made this submission to help others. And, I think definitely digging down to the root cause is such an important skill that we need to take advantage of, because if we don't, then sometimes a lot of the treatments we offer will just serve as band-aids. And I see that a lot with, and I know you'd mentioned you work a lot with people with chronic fatigue, and that's one area where it's like, but why? And usually it does take a lot of insightful work, a lot of really digging into even what seems like minimal details to understand why people feel just exhausted all the time, and they have this chronic fatigue. And I know that that's something that you really do have a passion for. So tell me a little bit about just some of the things that you see that does cause chronic fatigue, because that's a very popular, why am I so tired all the time? So what are some of those causes that you tend to?
And there's so many factors, right? And especially when we think about, entrepreneurial women, professional women, that's where I was, I had a time where I was trying to climb the corporate ladder. And you don't realize how much energy and the chronic stress that takes. And it starts to take a toll on your adrenals, and it starts to take a toll on, your body is almost like in a constant fight or flight mode all the time. And, in the beginning, that's all fine and dandy, but when you're doing that, over a long period of time, you just can't function. So what do? We get dressed, we go out, we get our strength, we muster it up, we go out into the world, we do our work, we act all professional, we put a smile on our face, and then we go home, and that's it.
Crash. Yeah.
That's it. We're done, right? We are done. And then that's all we can do. All we're doing is basically, that's how I felt. Like that's all I could do is just work. And if I'm not working, I can't do anything. I literally had no energy to function. And then you start seeing other symptoms of that, right? You start seeing like leg swelling and inflammation and body pain. And it's just like this downward spiral that all comes from this chronic stress. And then, you're not eating properly. So now we're not getting the nutrients. So we're impacting our gut health. Maybe we're now starting to get a lot of nutrient deficiencies. We're over caffeinating. We're not sleeping, right? And it starts to turn into this big cycle of what's causing what. We don't know. Right? We're stressed. We get our coffee. We try to stay awake because we're tired. But that coffee is causing, you to not be able to sleep. So now you want more coffee, and now you're eating. So now your blood sugar is imbalanced, and it starts to unravel into this craziness. But I see a lot of that, chronic stress impacting your adrenals. I see a lot of nutrient deficiencies, a lot of vitamin Bs, because Bs are so important for stress and stress management. And we're not getting sufficient quantities into it. A lot of times we have digestive issues, so we're not absorbing a lot of these nutrients. So many things that are necessary, and it's just not, again, it starts to downward spiral. It's, one thing starts to add up to another, and it's a matter of figuring out, okay, how are we going to look at this? And where do we start, And usually where we need to start is stress management, sleep, right? And getting those things in line. No,
I love that. I think I agree. I think it's a combination of several things. From what I'm hearing you, stress is a huge driver, especially for professional women. You're just constantly at that super high stress level. And over time, you start to burn out and you start to get the symptoms. But when you're so stressed, you may not necessarily be taking good care of yourself. And so we're not eating well, we're not eating right. And we have this changes in this, our gut's microbiome, right? Digestion becomes an issue. We're bloated or no, constipated.
Yeah. And let's think about even the microbiome. Like now we're doing so much. I think it's only over the past 10 years where we're realizing more and more our neurotransmitters are mostly made in the gut, So now we're depleting that, and maybe we're having B deficiencies. Now we're having some depression and anxiety. But let's take a pill.
Yeah,
Right?
absolutely. So how do you then, because you're not with functional medicine, you're not like, you don't prescribe medicine, but you do work with clinicians. I think this is where members of the team sort of come together, right? And you have this program where you help women, and if they do have issues where they need medication, which may be the case, but I think the approach, it sounds like, is, yes, there may be a role for medicine. It may be that it's being used more than it's needed, but before we even start medicine, or if we do start a trial of medicine, how do we look back in and say, okay, what's working, what's not working? How do we get to the bottom of the reason why stuff is not working or working, right? So how do you then integrate that for, say, a woman who is like, listen, I'm just exhausted all the time, I'm fatigued, and, I don't know if it's in my head, I feel lack of motivation. It's so many things, right? You said, where do you usually recommend starting?
I usually recommend starting with a regular medical physician, making sure that we are crossing our T's, dotting our I's, and making sure that there's nothing there that is of any type of alert, right? We want to make sure that, you're being properly checked. And I ask all my clients to make sure they have a physician that they work with as well. For my work particularly, what I do is I do a full intake, full medical history, going all the way from when you were born, were you breastfed, were you bottle fed, when did you travel, were you sick, were you on a lot of antibiotics? You will see so many connections start to unfold, I recently had one where, 2016, she had a food poisoning. And 2 years later, all of a sudden, she's developed IBS. But here's a pill to help with the IBS. Okay, well, maybe there's still some lingering E. coli or something going on there, right? That needs to be resolved. Again, we start looking at that timeline to really get a better assessment of, okay, what are some factors here? Is there a history of cancer? Maybe there's some detoxification issues. And then we get a symptom questionnaire where, you basically score from 0 to 5 based on severity, what your symptoms are. And that, together with the intake information, really lets me look at a full picture of, what are some of these connections? What am I looking at? And where do I think is the best place for this particular person to start? Because everybody's different, right? Where do we start the exploration? And I always say it's never, I'm not diagnosing. I'm looking at imbalances and connections and, things like that. How do we start the process? Because think of yourself like an onion. And we start working on certain lifestyle modifications, maybe add some supplements, maybe look some gut healing, whatever it is for that person. You'll notice that as you start peeling and you start doing the work, now that there's more clarity, because a lot of times when they first come in, there's so much going on. It's hard to see, even for them. They don't even know what's causing what. And it's really interesting to watch them suddenly being super aware of their body and the reactions that things are causing and how their body's responding to certain triggers. And you start to realize, and those little layers start to peel, and they're like, okay, well, you know what? We've cut all your symptoms in half. What's remaining?
Yeah.
So what is there to explore more? What am I missing? And together with the client, we're almost like working together as a partnership to now start to keep researching, keep digging deeper to try to get them to full resolution. Because the goal is to not have them as my client forever. My goal
Yeah.
is to say, fly bird, you know, you're on your own now. You got this, right?
Yeah.
And so, yeah, that's pretty much the whole process that we go through from beginning to end. It's really
Got it.
fascinating. I love to see the whole unfolding as time
Yeah,
goes by.
no, I think that's beautiful. And I love the fact that you're constantly still looking to say, is there a, is there a medical condition that needs,
Mm-hmm.
that needs to be addressed? For me, is it something like, do you have sleep apnea? Do you have,
Mm-hmm.
things like that, which,
Yes.
yes, you need to start you on,
Yes.
CPAP, or do you have of course, like thyroid issues. I think those are things that are
Yeah.
really important. And so making sure that you have the sort of clearance by your physician saying,
Mm-hmm.
well, the major like big players, which,
Mm-hmm.
we may be looking at seem to be
Mm-hmm.
doing okay. And so now
Yeah.
we're really now left to the point where, okay, it seems like there
Yep.
may be links that we need to connect. So I
And
love that.
and that's where I feel that, yeah, and I
Yeah,
agree. I think it should be something collaborative. It should never
yeah,
be one or the other. I feel like this should be a
absolutely.
teamwork, you know, it's
Yeah.
not just, you know, it should be all of us together in
Mhm.
in service to the client, right? And
Yeah,
to the patient for
absolutely.
sure.
Yeah,
And
yeah.
I think that that's where I feel like pharmacists are going to really rise to this as well. And I think a lot
Mhm.
of us are because, especially for me, I worked a lot in retail,
Mhm.
and you know that we're the first ones that people come to when they don't
Yeah,
feel well. You know,
yeah,
and many people, a lot of times they don't have insurance and they'll come in and
yeah.
I've got a rash and I've got this, I've got heartburn, I don't feel well, I'm dizzy. And,
Yeah.
you know, we're sort of always been the ones there to help
Mm.
and, you know, consult with them and ask questions and explore a little deeper. And I think it gives us also that insight, you know, especially with all the prescriptions and, you know, everything that we're having conversations with doctors all the time, right? Is being able to, again, notice and know there may be something else going on here,
Yeah, yeah.
you know? And this is definitely something I want you to get checked. You need to get explored. You need to make sure that this part is fine. So,
Mm-hmm. Yeah, this is great. So what would you say are like your top three, tips, regardless of what the underlying issue is? There's probably like
mm-hmm.
a fundamental sort of basic things that most clients need to address or pay attention to in moving them to the best versions of themselves. So
Mm-hmm.
what usually are like your top like three, like absolutely this is non-negotiable, these are three things you need to pay attention to, while we of course continue to
Mm-hmm.
work on the underlying issues?
Yeah. Well, definitely sleep. That's always the first one, right?
Prioritize.
We need
Mm-hmm.
to prioritize sleep. That has
Yeah.
to be number one. Prioritizing time for self-care,
Mm-hmm.
right? And then we're looking at, you know, stress management because it
Yeah.
doesn't matter what you do or how much you do. If you're not sleeping and managing your stress, it's not
Yeah.
going to last very long. You might feel good for a short
Yeah.
time, but it's
Yeah.
not going to, if you want long lasting, full resolution, you know, this is now your life, a lifestyle that's
Mm-hmm.
not going to change at all. And I think it's really important too. I always say, if you're not sure even where to start or you're feeling lost, um, take some time to reflect
Yeah.
and start noticing and writing down how your body is changing or how it's feeling. Because just by being aware, we there's so much change that can happen just from that awareness. I think
Yeah.
that's really important to start logging and journaling and
Mm-hmm.
you know, I started maybe you know, I've been drinking coffee and you know, I'm noticing that I'm not feeling very well. I'm really wired and I can't sleep, or maybe I drank it too late or too early, or, you know, something to that extent. Or I've noticed that when I eat this, I'm really tired and I'm
Mm-hmm.
feeling fatigued, right? Or this activity drains me. Maybe I exercise too much
Yeah.
and now I'm tired all day. maybe I need to adjust my exercise regimen, right? So really reflecting, journaling, documenting, and seeing where you see patterns can really help you at least to get that start, that momentum.
Awesome. Awesome. I love that. I love that. This has been really, really, really informative, and I've really enjoyed this conversation. Like, there is help out there. I think from what I'm hearing is there is help. Don't just take this is me for an answer. Like, just keep going down to but why, and advocating for yourself, and having people doing the amazing work you do, Jacqui, where you're really partnering with the client and making sure that they are, they're advocating for themselves. If they need more workup done before, if a pill needs to be given, but why, really helping to make sure that that's not just a band-aid. I think it's pretty powerful. So where can we find you? Where can we work with you? How can we get access to more of this?
Well, you can find me on JacquiOnoz.com, and you'll have all my links there to all my social media handles. And there's also a prompt there to book a call with me if I'm offering a 30-minute free consultation. If you wanted to just call and communicate with me and just let me know what's going on and hear your story. I will be the first one that will help guide you and tell you maybe what your next steps need to be. If I can help you or not, or maybe there may be someone else that can help you more. So definitely be open to having the conversation.
Yeah, it always starts with a conversation, and I'll put your the link to your website and social media. I'll put it in the show notes as well. Jacqui, thanks so much for coming over and spending time with me. And I hope
we need to do this again. This was fun.
Yes, I know there's so many levels to this. I'm thinking, but we'll keep this short and sweet. There's just so many levels to this, really. And so thank you for the work you do. And for you out there, if you feel so exhausted, you've done sort of all the things and you still just don't feel like you've gotten answers, this is definitely something to look into, like what else could be missing. And also, if this is valuable for you, definitely like, share, subscribe to this channel, comment, let us know how this resonates. And until next time, I hope you rest well.